As several states have doubled down on restrictions to prevent the spread of the coronavirus ahead of the 4th of July weekend, Florida Governor Ron DeSantis says the state will not go back on reopening. Cases of the virus have surged in Florida in recent days. There have been more than 152,000 cases of the virus in the state and more than 3,500 deaths. That is almost 3 times the number of cases from just a month ago. Marc Caputo has been following the very latest out of Florida. He's a reporter for Politico, and he joins us now. Marc, correct me if I'm wrong. I hadn't seen the governor over the last couple of days. It struck me that he was sort of avoiding the press. Did see him yesterday. Has he explained why we're seeing a spike in cases of the virus in Florida? And what can you tell us about the current state of testing there?
The governor has kind of belatedly admitted in the past 10, 15 days that there's community spread in the state. Before then, he was relying on the falsehood that, oh, we're seeing more positive cases because we're seeing more tests. But it turns out that's not quite the case. However, he is saying accurately that what you are seeing is more younger people, asymptomatic people infected, and you're seeing certain clusters which help account for it. But again, as the numbers continue to increase and increase and increase, as the positivity rate rose, that is, as the percentage of infected people relative to total tests kept increasing at a faster rate, he was kind of forced to acknowledge that, yeah, we've got community spread in Florida. And while he's saying we're not going to go back on reopening, he sort of did, in that he ordered bars essentially closed. That is, they can no longer serve alcohol. I'm in Miami, and in Miami, the bars here were not allowed to serve alcohol. They had been closed the entire time. But Miami is a leader in coronavirus infection rates, and we are ticking up. We are seeing our hospital rates increase as well, along with the rest of the state.
So I was sort of curious about that decision to ban alcohol consumption at bars, which essentially does shut down the bars. But why it was that, DeSantis didn't want to just outright say we're shutting down the bars because they seem to be hot spots. Instead, he took this backdoor approach. I'm wondering what people are saying in Florida.
Well, the governor's polling numbers the last we saw aren't the greatest, especially they're not as good as other governors, even those who have had higher infection rates and more deaths. I'm thinking of Governor Cuomo, albeit Cuomo, charitably speaking, got more favorable news coverage for handling his crisis in a worse way. That is, when it came to his policy of handling nursing home deaths and nursing home admissions of people who have COVID infection. The governor's approval ratings haven't been increasing, however, and he hasn't been very consistent in messaging, in that for some time he didn't stress very clearly the need to wear a mask. When he had press conferences, he didn't wear a mask, that is in between the speakers. And only recently has he begun doing that rather consistently. Now, there is a call for the governor to require statewide mandatory mask wearing, but he's resisted that. He's saying, well, what do you say to the rural areas where they don't have as high an infection rate? This is only in the urban areas. And incidentally, the urban areas have not only a mask wearing ordinance, but a higher infection rate. The counter to that is that when you pass a statewide order like this, it communicates the government's seriousness about the issue, and people get the message and start doing it. Now, however, we are seeing a lot of partisan separation on this issue, and in more conservative areas, there's far more resistance there's far more resistance to wearing a mask and having a mask wearing requirement.
Mm-hmm. Well, so you talk about the mixed messaging from the governor versus that of mayors, depending on where they are. Officials in Jacksonville have also issued a citywide indoor mask order to prevent the spread of the virus. As you know, Mark, the city is expected to host the Republican National Convention in less than 2 months. There were some disagreements between President Trump and the governor of North Carolina, Roy Cooper, over potential restrictions, which then caused the convention to be moved out of Charlotte. So now it's going to Jacksonville. We're starting to see Republicans at the national level urging their constituents, Marco Rubio, others, to wear masks. What can you tell us about what's going down in Jacksonville?
Well, the mayor, Lenny Curry, has received a good amount of goodwill from Democrats as well, because early on he took coronavirus seriously. He locked down his county. He though Jacksonville is in Duval County, it's a strange city in that the city is essentially the entire county of Duval. So his citywide mask ordinance applies across the county. Is people like the way he handled it, and they had a lower infection rate compared to places like, say, Miami, where I am. Now, as the convention started to come to the state, as it came to Jacksonville, polling has shown that Lenny Curry's approval ratings have taken a hit, as well as Governor DeSantis. But he decided in the end, look, I need to do this because it's important, and so that's why it got done. Now, the Republican National Committee, which is in charge of the convention, they have put out a statement that didn't dispute, didn't deny, didn't dislike this mask-wearing ordinance or order. They left themselves a little bit of wiggle room in that they essentially said, look, this convention is going to be in late August, so who knows what's going to happen then. Past this prologue, though, I don't really see a massive reduction in coronavirus infection rates until then. Hopefully, though, more people will be getting the message, more people will be practicing social distancing, mask wearing, where we will see a reduction by that time.
You wrote an article for Politico, and you called southern states a ticking time bomb for the president's re-election hopes as COVID-19 cases continue to tick up. Explain what you meant by that.
Well, for a while, the president was able to point to New York and say, look, these are, or Michigan, these are Democratic-controlled states, and those democratically controlled states had higher infection cases, they had higher death numbers, and there was talking point at the time saying it's not happening in these Republican-controlled states. Well, now it is. I don't want to pretend that Florida's situation is anything similar to New York's. In fact, if you add up Arizona, Texas, and Florida's death count, it's even though those three states, two of them are bigger than Texas, or pardon me, two of them are bigger than New York, they have more or fewer deaths than New York does combined. That said, we are seeing the governors in Arizona, in Florida, and in Texas backtrack, at least on their rhetoric, if not on their policy. And we're also looking at the polling. I mean, Texas has gone Republican every time since 1976, and before then, since 1964. The idea that Texas is now a battleground state where the president in some polls is only leading by one is pretty astonishing. In Arizona, which has been a reliably Republican state, which has only voted recently for a Democratic candidate once in 1996, now shows in the combined polling average, the Democrat Joe Biden leading President Trump by 4. And here in Florida, a must-win state for the president that we're obviously talking about, the combined polling averages show Joe Biden ahead of Donald Trump by about 7. And these poll numbers are ticking up at the same time the coronavirus case numbers are ticking up. There does seem to be a correlation. How long will this last? How strong is the correlation? How great is the polling? I don't know. We're going to see. But you can look at the body language of the Trump campaign, and they're not happy with where they are.
Those are some interesting observations and numbers. Marc Caputo, thank you so much.
Thank you.